Completing the educational zones and passing the reliability testing is only the very beginning of all that the MBSImP was designed to be. Once the testing is successfully completed, an important and very functional section of the MBSImP becomes available, the Patient Data and Reports section. Here, registered MBSImP clinicians have access to a collection of web-based tools that can be used daily to store and manage individual patient MBSImP assessment and treatment data in a secure HIPAA-compliant database. To automatically generate standardized, editable MBSImP study reports that can be imported into most electronic medical records. To connect with other MBSImP clinicians from around the world via a forum to initiate discussions on the MBSImP and related topics. Compare MBSImP study and treatment results over time. Generate data for performance improvement studies. Track patient progress and outcomes with template query functions. Collect data that can assist profiling variations of swallowing impairment in terms of presentation and recovery patterns across like diagnostic categories. Demonstrate evidence for targeted treatment. When entering the Patient Data and Reports section, clinicians will see a link to access the forums, a link to add a new patient, as well as seeing all patients that have already been added to their database. Well-organized screens coupled with point-and-click completion for 98% of all fields make data entry efficient and quick. Before results of an MBSImP study can be entered, each patient's medical history must be present within the system. Entry of information is de-identified and complies with HIPAA guidelines. Diagnoses and conditions are organized according to body system and classified when entered by chronology of episode. Selection of certain cancers, such as head and neck cancer, elicit subscreens that permit entry of additional pertinent information concerning surgery, radiation, and chemotherapy as applicable. Entry of surgical history, non-surgical medical treatment history, social history, and medication and allergy information complete the patient history screen. The entry screens for each MBSImP study provide input fields for Joint Commission mandated data such as pain assessment, procedural timeouts, barriers to learning, and whether or not education was provided and understood. Fields are also included for pre-study route and nature of nutritional intake, information on patient positioning, radiographic viewing planes, fluoroscope settings. Upon completion of the study, the MBSImP scores for each component can be entered. The penetration aspiration scale is also provided. Delineation and success of strategies used and exercises that have been used over a course of therapy and seem to have been effective. Post-study recommendations for nutrition, referrals to other disciplines, and of course, proposed plans of care, short and long-term goals and frequency. Once the data is saved, the patient's medical history and MBSImP study findings are placed in report format, which can be viewed and downloaded for editing, distribution, or transfer into an electronic medical record system. The length and detail of each report can be controlled by the selection of the data entered. As many or as few of the available entry fields can be completed, but keep in mind, all data entered will contribute not only to the integrity of the study report, but to future research, as it will be maintained in the MBSImP database, which will in effect function as a data registry dedicated to the study of swallowing impairment and international in scope. This concludes the tour of the MBSImP.com. Please email any questions to mbsimp@northernspeech.com. Thank you.